Endometriosis? Progesterone to the rescue. I'm Barbara Hoffman. I worked in an OB/GYN office for over 13 years. The usual choices you were given were surgery or synthetic drugs. But you can first use progesterone in an attempt to contain endometriosis without surgery. Now, endometriosis can be a very painful disease, especially during menstruation. If you have endometriosis or know someone does, you know what I'm talking about and how they suffer. Endometrial tissue grows outside the uterus instead of within where it belongs. Then around the time of menstruation, it fills with blood and swells. It's so painful. Fact: estrogen dominance is a contributing factor to endometriosis. Excess estrogen causes proliferation of the endometrial cells that are growing outside the uterus. Many endometrial patients treated with progesterone observe considerable success because progesterone will block the monthly estrogen stimulus and can stop further proliferation of those cells. And listen, it is known that when a woman becomes pregnant, endometriosis will often disappear. And then it comes back after the pregnancy. Why? The high progesterone levels produced during pregnancy play the critical role. So, when progesterone is used in a pattern to mimic a pregnant state, healing can occur. Now, the doses used for women with endometriosis when they're using progesterone are higher than normal. They use about 60 to 80 milligrams per day. Here's the protocol from the researchers. You use progesterone cream from day 8 to day 26. Now you're going to use 1 ounce of a cream. For instance, with our ProHelp, it would be half of a jar. Or a similar progesterone cream that has 1,000 milligrams in it in the jar. Use half of the jar per week for 3 weeks, stopping just before your expected period, usually about day 26. The progesterone decreases the effects of estrogen and makes you feel better and promotes the healing. Some experts say that in severe cases, you could use the cream daily. Now, this treatment requires patience, but over 4 to 6 months, women report that pain gradually subsides as the inflammatory sites heal. You may find that you can reduce your dose of progesterone after 8 to 12 months, but symptoms may reoccur if you go below 40 milligrams per day, which would be a quarter teaspoon twice a day. Most women that have endometriosis like to remain on their progesterone cream to maintain healing. If the pain comes back, you just adjust your dose back up again. Take heart. Endometriosis is almost always cured by menopause when estrogen levels drop. So if you can get by without surgery, that's great. The treatment of endometriosis by surgery or synthetic drugs is often unsuccessful or temporary. So I believe you have nothing to lose by trying a course of natural progesterone. Many women have reported remarkable success. I've heard from women who have had complete hysterectomies after they used the drugs and pain medication finally failed them. Many did not know there was an alternative approach, but now you know. Give it a try. Save your ovaries and uterus. There are some other supplements that can help, so email me for my endometriosis handout and I'll get it in your hands. I believe you will prevail.